How do we record on this one? Oh, I see it. Okay, recording. So we have a couple things to go over this morning, and all these are videos that potentially go onto your iPad, so you don't have to take notes. Oh, I see you weren't going to take notes, I see. So we have a couple things to talk about. One is, this is the first draft, let's say, of the message to your doctor in the ER. So I'll be looking out at the camera and I'll say, "Hi, if you're watching this video, you may be a doctor in the emergency room seeing one of my patients. I'm Dr. Rutledge, and I do the surgery called the Mini-Gastric Bypass." And I thought I'd tell you a little bit about that and what to expect on your patient in the ER. And don't hesitate to call me, of course, anytime, day or night. My telephone number is 702-714-0011, and my patient should have that, although sometimes they lose that number. So in case, you can call me anytime, and the patient's also encouraged to call me at any time, both now, while she is or he is in the ER with you, or as part of follow-up. So don't hesitate to call. If you use email, I do have an email address if it's something not urgent, and that's drr, that's Dr. R, at clos.net. And so let me tell you a little bit about our surgery. The Mini-Gastric Bypass is like, in some ways, the Roux-en-Y gastric bypass, but it also has some significant differences. One is that the patients who have the laparoscopic Roux-en-Y gastric bypass face a fairly high incidence of partial or complete bowel obstruction. Some series will report up to 10% of bowel obstruction after the Roux-en-Y gastric bypass. And in general, what we have found in over 5,600 patients is bowel obstruction after the mini-gastric bypass very rare, very uncommon. We really haven't seen it except in a handful of patients. And in those patients, they also had other previous surgery which appeared to be the source of the bowel obstruction. So a patient of ours who presents to the ER commonly presents with abdominal pain. The most common reason for the abdominal pain is gastritis or an ulcer at the junction between the connection between the stomach and the intestine. That is a Billroth 2 loop gastrojejunostomy, and as you well know as a physician, that type of connection has been done for over 100 years, and it also is well known to have a complication known as a marginal ulcer. And that's the most common reason our patients end up in the ER. A common scenario is that this problem occurs 1 to 10 years after surgery, and oftentimes our patients have had a good experience. They've had excellent weight loss after the surgery, and then they begin to feel like they're normal. So oftentimes we'll see resolution of diabetes, high cholesterol, osteoarthritis pains, sleep apnea, high blood pressure, and following that, as the years pass, they begin to forget some of our concerns about marginal ulcer. When that happens, oftentimes they will begin to forget what we've told them as far as advice in the postoperative period. So our advice include things like no alcohol ever after surgery, no cigarette smoking, no aspirin or aspirin-like drugs after the surgery because of the risk of ulceration. We recommend that there are some prophylactic things that they should do, including eating a small amount of unflavored, plain yogurt every day. That they should be taking Tums as an antacid every day. And what we find as time passes, oftentimes people feel so well, they begin to forget these things. And so they have a drink for New Year's, have a cigar with a celebration, and pretty soon smoking, drinking, maybe drinking soda pop, things like that come back in, coffee, stuff like that. And with that, oftentimes we see the complication that is most common, and that's a marginal ulcer, gastritis, usually at the junction between the stomach and the small intestine. The vast majority of these can be treated non-operatively, but in the case where the patient has proceeded to a perforation or bleeding, again, that's usually easily taken care of by emergency exploratory laparotomy and a suture repair of the bleeding site or the perforated ulcer. Again, don't hesitate to contact me to talk about this if you'd like. There are a couple of other things that happen to our patients post-op, and we'll provide you with some other videos about that on this website and on the iPad. So don't hesitate to get in touch with us And thanks very much for looking after my patient, and please give me a call. Thank you very much. Yeah?